Good afternoon, everybody, and I want to acknowledge the organizing committee for inviting me in this very interesting and nice conference. We will speak about back to competitive football after this Achilles tendon repair. This is a case study of one player when I was working in Inter Milan. How this talk can affect knowledge and practice? I think that two interesting points should be considered: return to play as a multi-factor approach, has been demonstrated and also in these days, and the importance of the outcomes coming from the field session. Let's see the background. We know that the Achilles tendon rupture may dramatically influence the career of an athlete. In this study, has been demonstrated and measured that the layoff days median is 169, so this can can provide higher stress for the athlete, but also higher cost, very high cost for the club, because the athlete is paid to play and he's not playing. So the return to play is considered probably the last part of a longer rehabilitation process, and this period is very stressful, both mentally and physically, especially for an elite athlete, because there are some external factors that can put stress. For example, the coach want the play come back, the managers of the club, the sponsor are losing money because these kind of players are not performing, and also probably other players. This can result in an accelerated rehabilitation process that can increase the probability to have another injury, or in the other side. We think that a more controlled process can reduce this probability. So in the literature, we know that strength, explosive capability like jumps or endurance in some patients with ATR shows differences between the two legs also after a longer period, 1 or 2 years. And in the literature, we have a well-described protocols in the rehabilitation, but less study investigated directly the return to play in elite soccer players. So in this case study, we want to describe this period. The patient is a very famous soccer player. He's 39 years old, Argentine defender. He was playing in the Italian First League, Serie A. At the moment of the injury, he has played 650 matches. And he's in the same club, and for 19 seasons he was in the same club. He was ranked in the 6th place in the overall ranking, referred to the number of official matches played. So I think this is the number of matches, official matches played. The injury, this is the one, the players. We have the video. The injury happened during a match while the players were running at the end of the field while crossing the ball in the middle of the area. We have a jump, and when landing, he perceived pain, and he is not able to continue the match. So the video is not very good, but okay. In that moment, when he was landing, he perceived this pain. So the diagnosis was done by clinical examination and MRI when we came to Milan, and the diagnosis was a total rupture of the left Achilles tendon at this insertional portion. So he has a surgery, and then after surgery we start with this marathon. The measurement I will present to you is the layoff day, so the absence for training and matches, as also presented in other studies. We have measurement of strength, the endurance for the calf muscles. So we control strength during the process, during the rehabilitation, and during the return to play with the concentric plantar flexor peak torque, considered as a main outcome for strength. We also consider the endurance of the measured as the number of hair rises performed for every week for the injury legs. Also, when the player was able to perform activity in the field, so while I start running, we considered some training loads, and we are divided, as the sports science literature suggested, in external and internal training load. External training load were measured with a GPS system, and we considered outcome and indicators the total distance performed every day during the activity in the field, the total distance per minute, the moderate intensity running, so that is running performed between 13 and 16 kilometers per hour, high intensity, so the activity performed higher to 15 kilometers per hour, and also the duration of every session. For internal training load, that is the effect that probably the external training load has to the body of the player. We measure heart rate, and we use this method, Edwards method, that is based on the distribution on the heart rates in different target zones. For the analysis of this data is a case study, so data from one player. We considered the standardized mean differences between the values that we have in our training center, referred to the pre-injury values, and the values during the return to play. And this is we calculated the difference between the two values and divided it by the baseline values, so the pre-injury data. This is a presentation, a schematic representation of this rehabilitation program. We have injury. We have divided in different phases the rehab period, control mobilization, early rehabilitation, late rehabilitation, and return to sport is all this period. We divided the return to field, return to team, return competition, because we think that the aims is different in different phases of this period. The criteria we used are different, second to as the period. Always there is a clinical medical assessment. We use full well-being, for example, full pace to pass from phase 2 to phase 3. We use this functional ability to perform 10 times free boots of rises, MRI, no pay while running. When he is able to cope with this criteria, he passes in the return to sport to play period. When he is able to cope with the ability, specific ability requested by the sport, and when he has enough endurance in his health rises, as demonstrated by this, the ability to perform 25 boots and 5 series of 25 boots, and also enough strength, we start working with the team. If there is no pain working with the team, we allow him to return to competition. But the final decision was made by the clinical, medical, and also the coach, because he had to put the player during the match. Very quick, this is the first phases, but it's morely physiotherapeutic. So I'm a strength conditioning, so I speak about more strength and conditioning part. We early prescribed to the athlete a resistance training program for the legs, because this is a particular athlete. He want always to train, but for muscle that are not related with the problem. And in this part, after 6 weeks, we had a stationary bike, and after that, we have a cycling endurance program. This is the phase number 3. It's very interesting for me, because it's a phase between a more physiotherapeutic part, the early phases, and a more conditioning part, the second one, the last one, the return to play. And during this period, in these weeks, we were in a training camp in the United States, and we performed some activity in the Alter G. Can you start the video, please? And these devices allow us to perform a lot of activity in the muscle, and also to walking a lot of time. And also we perform some activity in the water, like walking, like skipping, like hip-hop, PT, like this activity. In the field, we only walk at different velocity. The criteria was met at week 30, 14, and 15. So ability to perform 3 times 10 boots, MRI, and running without pain. So we can pass to the next phase. Next phase, return to play. We have, for all the days, we have physiotherapy, but also we have activity in the gym, so like spinning activity, like balance exercises, some resistance for the legs, and we introduce some more functional exercises like lunges, and we work in the strength of the muscle with standing and seated overload calf raises, like this, and introduce the isokinetic activity. Isokinetic program is described in this table. We try to increase both the repetition and gradually the sets for every weeks. For activity in the field, we have walking, running. We alternate some walking and some running, and we have activity with the toes in the tip-to position in the sand, and in like walking, like skipping, and also in this particular pool that is reached of expanded clay aggregate that is anecdotally produce a load in the muscle, so the player perceived higher fatigue in the muscle and no pain in the tendon. I think it's similar to do something in the snow. I don't know. The results of this period. The results is from the outcome related to the force, to the strength, peak torque, and the plantar flexor. We know that we found there is an increase in the strength at 13 degrees second. We found also the outcomes, the external training load. These are the standardized mean difference, so the FSIs, and is the classification of the FSIs. We can see here, in this part, there is a lower total distance running activity, lower height intensity activities in this period compared to the pre-injury values, but we have higher exposure to activity in moderate intensity. For the internal training load, so the effect that this activity has on the body of the player, we found that there is a lower values compared to pre-injury, and the exposure was also lower. Second stage, in this return to field period, weeks 18-20, we introduce eccentric movement gradually overload. We introduce some plyometrics exercises and explosive movement in the water, so in the pool activity, and we increase the activity in the field. We had some agility, low intensity agility exercises, so like skipping, like the speed sledge, like working in the handles or slalom and so on, and some air rises also outdoor. What we found? We found is continuous increase in the values of strength. This is the peak values measured during the training with the isokinetic device. For external training load, we found an increase in all the values for total distance and for moderate intensity activity, not for the high intensity activity. And this demonstrated the graduality of the exposure to high intensity activity. So the high intensity activity start to increase in the second part, in the last week of this period. The internal training load is similar to the other, so there is an increase in this value. So for lower value compared to pre-injuries, from higher values compared to pre-injury related to the internal training load. Also the exposure, the duration of the session were lower here, similar and higher compared to pre-injury values. Last weeks, we have same activity in the gym, same activity in the pool. We introduce some other activities in the field, more specific activities, so some plyometric exercises, some high-intensity exercises like sprinting, slalom, some activity with the ball, change of direction, some circuits like this. We also add interval training, so activity at the 90% of vertical max, so very high-intensity activity, technique, and intermittent running. This criteria was met during this period. This is an example of one session in the week 21. In the branches, we have the duration of the single activity. There is no recovery between these, so this session starts with a warm-up like a FIFA 11 Plus modified, so only the activity in the field. The light agility intensity activity, walking, hair rises, plyometrics, interval training session, another time walking, light intensity walking, hair rises, plyometrics, intermittent activity session, so 22 minutes of this activity, and light intensity walking plyometry and so on. The result of this session was in this block, the total distance is very high, is similar to what performed during the match, higher, probably higher. The duration is 94 minutes, so the exposure is similar to match. Total distance per minute, the high intensity activity is 2,046 meters, and moderate intensity activity. So this is very demanding session. What we found, related to this period, we found there is no activity here because we allow to recover the muscle unit, and the external training load show us a peak. So there is a very high intensity activity, moderate intensity, and total distance. All the indicators show us a higher value, very high value compared to pre-injury values. Similar the internal training load, and similar the duration of the session. After that week, we give a week of reduced training just to taper, so to recover and to perform better in the other weeks. And we can see here, the last part of this period, there is a lower distance is covered, but we maintain a sort of high intensity activity. Last week, so the player returned to train with the team, so there is activity with the team, and we had sometimes some repeat sprintability, some sprint training exercises, some explosive training and plyometrics to try to maintain and to increase these capabilities. In this graph, we can see the values of the force, of the strength in the peak torque plantar flexor muscles, but what's interesting is that after the 6 months and after 9 months, we found great differences between the two legs. So 20% at different velocity, 20, 24, and 20% is the difference. So it's very important. This is the number of the endurance outcome, so the number of total air rises performed for every week in different situations, so in the alter G, in the pool. What is interesting in this is that all during this period is concentric movement. We introduce eccentric half movement start later probably. Main outcome, specific ability to cope with what is requested by the sport. We compare return to play GPS data with pre-injury GPS data, total distance per minute, and we have this situation, so it's higher. And also with activity during the match. So in the match he played before the injury, we compare and we have higher value. So the result of this adventure is that the player is older compared to the UEFA study group that presented in the first slide, but we have this lower layoff time. He played after the injury half of the remaining 26 matches in the season, but at the end of the season he decided to finish his sport career. But this decision was not due to the ATR injury. Psychological aspect is very important. I think it's the main important in this trip. This is the after 7 hours after the injury, when he was entering in surgery, he tell the surgeon this phrase: "My career is not finished, but I had to change the tires. So I want to come back stronger than before." Take-home message. I think that during a turn to play, monitor both internal and the external training load can help to control the ability of the player to cope with what is requested by the sport and what is the, if we have data, what are the previous value, especially in this elite sport athlete. Compliance is very important. This player is very too much compliant. And in addition, for a psychological point of view, I think that the training load data can be used to provide feedback to the athlete every day. And this can support and provide to increase consciousness in this player, in the players to have the ability to return to play. I want to acknowledge the rehab team involved in this rehabilitation, and thank you for the attention.